was on pregnant women and infants with substance use during pregnancy. So it includes the pregnant mothers who are abusing substances and then the infants who are exposed to those substances in utero. So the 3 learning objectives, the first one being understanding the population of not only the infants exposed to substances, but also the mothers who deal with substance abuse disorders. The second objective is to know how this group is marginalized in healthcare and society. And then the last objective is to learn about the solutions and the resources that are available for this specific group. So the group of women who use substances during pregnancy and the infants who are exposed to them are marginalized because they don't have a lot of resources available, and also there's a lot of stigmas around this population. This group can be defined as not only the mothers who have substance abuse problems, but also the infant that's exposed prenatal. The substances that can be included are tobacco, nicotine, alcohol, cannabis, or prescription drug use or misuse, meaning if the mother was on prescription drugs and used them during pregnancy, or if she is misusing illicit substances. The baby develops adverse effects with their development due to being exposed in substances in utero, and that's another reason why they are vulnerable, because of a lot of the consequences and effects that happen due to the mother using when they're pregnant. And the last thing is, the first step to decrease both of these populations is for the mother to find help at the beginning of the pregnancy, so that she can either be weaned off the drug she's on or be put on a different substance that's not going to affect the baby. So the second part of the presentation is vulnerability and marginalization in society and healthcare. So in society, a lot of times people see the mother as a villain because they don't understand how a mother could be using drugs or other substances when she's pregnant because of how it will affect the baby. But a substance use disorder is a disorder. It's not something that they can always change, which a lot of people think that people who struggle with drug disorders or like addiction disorders can change that. It's just a different type of struggle, but it still is a struggle, and people will compare them and see using drugs or substances during pregnancy as worse than other things such as mental health disorders. And then in healthcare, a lot of healthcare views substance use in pregnancy extremely negatively, and they put a lot of bias into specific groups of people who do use substances in pregnancy. Although not all people in the healthcare field view mothers as bad people, the mothers who use substances, but in healthcare there are a lot of stigmas around women who struggle with substance abuse disorders. So the biggest social justice issue is women not wanting to look for help because they are feared that they will be incarcerated or lose their children or be imprisoned. So instead of society treating this as a health problem, they treat it as a criminal law problem. And so a lot of times pregnant women will not look for help because they are fearful of punishment because they are using drugs during their pregnancy. And it's known that women have reported that they delayed or avoided prenatal care altogether because of fear of punishment. So for access and equality of care. So pregnant women who struggle with substance abuse disorders don't often look for help because, as I previously said, they are feared of being criminalized and judged. In result, they're not going to go looking for prenatal care because of how others will play into the stereotypes and stigmas around them. And as I had said earlier, instead of seeing substance abuse in pregnancy as a health problem, it's made into a criminal law problem. And we've used the criminalization of certain drugs and controlling certain groups of people to put them in jail in a way. And then it's shown in a lot of doctors and therapists who have worked with mothers who struggle with addiction. The mothers still love their children, and a lot of times in society, people don't believe that moms still love their children. They think that the mothers are very selfish for still using during pregnancy, which is not true. And a lot of times, mothers are just fearful, as I said earlier, of finding help because they struggle with the idea that they would be separated from their children. Another part of this is when women would be incarcerated, sometimes they are taken off of the medications that they have been on, or they're not prescribed medications that can actually manage the cravings and withdrawals, and this can be very dangerous for mothers and the infants in utero. Some solutions for this is, the first one, when women do come into the office or a healthcare setting, for them to be screened for use or misuse of substances as a routine part of obstetric care. That way, if someone is positive for illicit use of substances or drugs or prescription medications, that they will have the tools and options available to them to get help with their addiction. A lot of times, moms will see the screening as stigma because they believe that if they do answer yes to these questions, that Children Protective Services or the government will get involved and their kids will be taken away from them. The second part of the solution is neonatal assessment to see if the infant is at risk for withdrawal. And this is important because after the infant is born, it's really important to know what type of withdrawal they would be going through so that medications can be administered to ease the withdrawal, so the infants are not at risk for more harm. The third part is providing mothers with information on substance use in pregnancy and the resources to help get them out of it. Because if those two things aren't done, then the cycle will just continue. And then some of the resources that are available in Pennsylvania, there's one called Vantage House, which is a drug addiction treatment center in the city, and it's exclusive for mothers and children. They provide housing, therapy, and follow-up care when the program is completed. The second resource that I found was Brookdale, which is another care center that helps people recover from substance abuse disorders, and they help set goals, and the patients will work with a clinical team to set these goals. And then the third resource that I found was Healthy Beginnings Plus with LGH, and the Healthy Beginnings program is free, and it also provides opportunity for someone to have a healthy pregnancy, along with giving the baby a good start in life. In this program, a doctor or a nurse care coordinator and a social worker help with the mother who is struggling with the disorder, and this also allows the baby to receive the best possible medical care because the mom is being helped as well.